Well, what are some of the symptoms? I mean, for me, it just hurts to say IBS, irritable bowel syndrome. Honestly, I can feel the pain. Is there pain, or what are some of the symptoms?
Well, there can be pain, but it need not always be a painful condition. So the most common symptoms would be constipation, if you're of that type of IBS, certainly frequent stools as well. And what I find is a lot of people have both. So they go from the constipation to the diarrhea, and that oscillates back and forth. So it's really hard to know what to eat, how to eat, when to eat. And that's some of the things that we're going to give you some tips on today in this hour. There could be a lot of gas and bloating and that uncomfortable feeling after eating. And usually people who suffer with IBS, when they break it down, they do start to have those pains and they're not sure what to eat. And this is, what can be so difficult. And we shouldn't have pain in the gut. As soon as there's pain in the gut, we know that there is something that is out of balance, and it's not something that we should be suffering through. So that's an indication that, something is out of balance and that we need to work on some of the solutions that I'll share with you today in this episode, which is fantastic.
So we do have some questions that people have been sending in ahead of time, and we really, really appreciate that. Q&A stands for questions with natural answers. Makes sense, right? From a naturopathic doctor. Questions with natural answers. So Irene was kind enough to leave us a message asking, and this is a great question, are women more likely to have IBS than men? And if that's the case, why is that?
Well, they're more than twice as likely as women to develop IBS. And one of the things that I would say is, yes, we all have stress, but I think because stress is such a big factor in IBS symptoms that this may be, women, speaking for myself and a lot of the women out there, you can attest to this, that we have a lot of stress and we have, a lot, especially with what's going on in the world right now. And I heard another program recently where they were really, and in the mental care field, were really worried about women, and a lot of women, were visiting their practitioners looking for solutions, because it's not just the stress of what's happening in the world, but it's the stress of the children, and now, having to go back to work and the children aren't in school yet. I mean, stress plays a lot, and certainly I can bet that the symptoms of IBS have gone up, certainly in the last little while, because of that stress. So women, yes, are more likely. And when we get to the Dr. Janine truth in this segment, you'll understand maybe why that there's that correlation with women more so in as opposed to men as well.
Makes perfect sense, and thank you very much for that great question, and keep them coming in for next week. Once we tell you what's happening next week, still to come in this segment or in this hour, pets, kids, a nice beauty tip for you. Plus we've also got a recipe on the way and much more. But Federica also left us a nice message asking if IBS is diet related. And it seems to me almost everything, if that's fair to say, can be diet related. Is that the same with IBS?
Well, that's a great question. So yes, it can be related to the diet. However, I don't always buy into the fact that it is related to the diet. So as much as, people that have IBS, they become very restrictive in what they're eating, and they may have heard things about gluten and celiac and all these things, and all of a sudden, because there's this wave of everybody having to go gluten-free, that people would jump on that bandwagon. This has actually been studied in psychological studies as to that effect of one person thinking one way and everybody follows suit. So I have to say that yes, diet can definitely be a factor, but when you've got the leaky gut, so when we're talking about the symptoms, but also now the tips for helping with the IBS, when you've got the leaky gut syndrome, which is something that we're going to talk about in how to fix this, then absolutely your body is now reacting to all the foods that it wouldn't have reacted to previously. And that's because the tight junctions have opened up in the gut. There's a problem now, and undigested food is getting into the bloodstream, and now the immune system has something to do with this. This is how we can get into autoimmune disorders. But it's all of this interplay of what's happening happening at the outset? And was it the stress that caused this IBS and this inflammation to happen in the first place? Or was it because of some of the bad organisms that we're going to talk about in just a few moments as well? So there really is this interplay when it comes to IBS. So I know this is a very long answer to your question. Is it food related? It can be, but it need not always be related to foods. And once you heal and you repair the gut, and that's what we're going to share in this hour, once you repair that gut, then no matter what food you're eating, for the most part, it's not going to have that inflammatory and that irritation effect on your symptoms, certainly for and with your IBS.
Great question, once again. Gurpreet also left us a message asking if children can develop IBS also.
Yes, that's definitely, I think, on the rise with the stress levels in children, and children not being able to deal with their emotions effectively and their stress, and not having great outlets for their stress, and developing these GI symptoms. So what may be a tummy ache, when you're kids, you don't necessarily think, or if your child has a tummy ache, you're not going to think, oh, it must be IBS. Maybe
no,
not.
It'd be too much popsicles or something.
Right. So, this is something that definitely, certainly see your practitioner and have this diagnosed, but know that the tips in today's episode will help for the children as well. So, that's a great thing to know, that you can do things naturally, and certainly dealing with the stress and allowing for your children to have an outlet for their stress, a healthy outlet, is something that's definitely part of the healing of the IBS.
Okay, it's good to know. It's not the sexiest topic of discussion, is it, IBS? But you know what? It's really important. It's something we all should know about, as well as parents, as we'll be talking about children, kids along the way too, plus pets, a beauty tip, and the recipes coming up, and much more.